I once prescribed pills and now I prescribe stories as a form of medicine is sort of what I like to say. We historically are taught to treat symptoms or treat diseases. And so there's got to be some sort of intervention that you can do, and then you pay for that intervention. And the system is sort of been built off of that type of process. It's called allopathic medicine. But we know that when you look at sort of Eastern practices of medicine, Ayurvedic, holistic types of practices, that there is some rationale to some of those natural remedies and ways of being able to look at health. And so I think what's really interesting is we're starting to see this convergence of Eastern medicine and Western medicine come together in a variety of different ways. But at the end of the day, I like to sort of simplify medicine down to its core basics. And you talked about this element of storytelling. All we're doing is essentially, we're changing the narrative of somebody's story today, and we're transforming that into something better tomorrow. And the methodologies and the tools and the modalities and the techniques and everything that we use to get from point A to point B might be different. And some of that also involves, for example, factors that you're involved with, our financial health and our education and our mental, like so many different factors that play into that. That's why I like to consider it as sort of a single asset. Like, how do we approach it with that plan in mind?
Welcome to Talking Billions. We talk about big ideas, big inspirations, big topics. We take on the hardest topic of all, money. How to make it, save it, keep it. But our conversations lead us to an even bigger question, what it means to live a rich life beyond money. My guests share their practices, principles, and evergreen wisdom. I'm your host, Bogumil Baranowski, author, TEDx speaker, and investment advisor to wealth creators with patient capital and an infinite investment horizon. I work with families and individuals who aspire to grow wealth over a lifetime and generations through disciplined, thoughtful investments in durable quality businesses while giving money meaning. Join me on this quest to unearth and share the wisdom of the ages. Let me share with you the podcast program disclosure statement. Blue Infinitas Capital LLC is a registered investment advisor, and the opinions expressed by the firm's employees and podcast guests on the show are their own and do not reflect the opinions of Blue Infinitas Capital. All the statements and opinions expressed are based upon information considered reliable, although it should not be relied upon as such. Any statements or opinions are subject to change without notice. The information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. Investments involve risk and, unless otherwise stated, are not guaranteed. The information expressed does not take into account your specific situation or objectives and is not intended as recommendations appropriate for any individual. Listeners are encouraged to seek advice from a qualified tax, legal, or investment advisor to determine whether any information presented may be suitable for their specific situation. Past performance is not indicative of future performance. None of what you're about to hear is investment advice. All right, I'd like to introduce Dr. Gautam Gulati, known to most as Dr. G. He is a visionary health artist who designs luxury spaces that embody health and longevity. As the founder of The Well Home, he envisions and transforms homes into wellness sanctuaries that promote health and prevent disease. With over 25 years of experience, Dr. G has significantly impacted global brands by challenging the status quo and inspiring innovation. Dubbed the Rick Rubin of audio storytelling, he captivates audiences with his award-winning audio docuseries called SUPERHUMANS. When off duty, Dr. G could easily be mistaken for Bollywood royalty. He captivates audiences worldwide as a renowned keynote speaker and cherishes outdoor life with his family in Great Falls, Virginia. Please join me in welcoming Dr. G for an in-depth conversation that explores his unconventional journey as an award-winning doctor and designer, and why he now calls himself an asset manager. How are you?
I'm doing wonderful. Thank you for having me.
What a pleasure.
Hello to all the viewers and listeners.
What a pleasure. We got to speak a few weeks ago, and I was really looking forward to it. And I jokingly said, I wish we recorded that conversation because it took us places. But here we are.
It did. Well, we're going to go down similar places today, I'm sure.
I have no doubt. I want to jump right in. And you might know that I like to kick off those conversations with the early days. And I know a little bit, but I'd love to know more. I want to ask you about your childhood upbringing and how you think that time shaped you, your relationship with, career. I say money, but in your case is wealth, health, wellness, everything else. And the career paths, I'm going to say paths that you chose because they're multiple.
Yeah, well, I mean, thinking back to my childhood, I mean, I didn't have anything notable to share, except I just had a very loving family, supportive family. My parents were immigrants to this country here. They came in the late 60s, early 70s. I was born in Canada, in Montreal. My dad, we come from sort of a lineage of medical professionals. So my grandfather was a physician in India. My dad was a physician and really influenced from his father-in-law. And then now I'm a physician. Of course, my sisters are physicians. My mother was in healthcare as well. So really a family of medical, with a medical background that really explains a lot of things that I'll share down the road in our influences. But they came to this country. They were they jokingly say that they came on their honeymoon for interviewing at different medical residency programs, and they never went back. And so they stayed here. And it was at a time when they were recruiting heavily for foreign physicians due to the shortage. They ended up settling in Montreal, Canada. And that's where I was born and my sisters were born. And they lived there for several years. But the youngest of the siblings that I have, we ended up moving here to the States when I was about 4 or 5 years old, in the Washington, D.C. area. But really just grew up in a household with great influences, great support, loving family. You asked about sort of relationships with health and we can get into some of that stuff, and also wealth and how we look at money. But from a health perspective, I think you have to understand that time was all about efficiency and convenience, and really stemmed into a lot of the problems that we have today with our health. And we can sort of dive into that later on. But the system was essentially designed that way. And now we're sort of seeing the repercussions of it in today's world. From a financial standpoint, I mean, we were pretty comfortable. I saw my dad, even though he was a physician, he sort of acted in a way that was like an entrepreneur because he opened up his own practice. I saw that he had complete control of his time and the way he, ran his practice and grew his practice. And so you can look at it in the one sense that, healthcare, you get the satisfaction from treating patients, but also it is a business, which, you can start to see from some of my background and graduate degrees that I saw it from that angle because I saw him building something from scratch, and that was something new for me. So, the way we sort of looked at it, you could either be on the camp of saving. We look at our, relationship with money. You can be the saver and try to save as much as you can, or you can be the creator or the seeker and try to make as much as you can. And so, you really fall into one of two camps. And throughout my career, I've always thought myself to be the creator and the seeker. So how do we generate greater wealth and greater income to do what we want to do?
I love the story of multi-generational relationship with the medical profession. And I grew up in a household with two physicians. So I spent a lot of time as a kid at the hospital seeing my parents. And I knew all the medication and the treatments. And it was kind of natural that I would go in that direction, but I didn't. I ended up going into an investment field and I serve people in other ways. But I see myself as a family doctor in a way because it's such an intimate pursuit, taking care of family fortunes. That's what I do. But I always found it fascinating. And I have uncles and aunts that are doctors too. So it's kind of a miracle that I didn't end up a doctor myself. But I'm always curious looking over shoulders of doctors that we interact with in our lives. And I'm just curious about what we can do.
It's so funny looking back on all the things, like the common thread between what you're doing and what I do and what so many others do. I mean, I tend to think of myself now as an asset manager, right? So when you look at all the different fields that are out there, like we look at our financial, health, we look at our, what we do we plan for education, we plan for our finances, we plan for all these other aspects of our lives, but very rarely do we actually plan for our health. And so, we as our bodies are just like machines. They break down over time. They need repairing. They need fixing. And so we need to look at it almost like an asset. And it's probably our most important asset because without us, without your body, without your mind, you're really not living. And so how do we essentially approach it with a plan in place to get us to achieve the goals that we ultimately want to achieve. And so, whether the component of that includes things like managing your finances appropriately, managing your social connections appropriately, managing your education appropriately, that all really builds into the most important asset, which is your health.
I think it's a very important point, because when I'm thinking of, there's time for a second, let's think about time, and there's financial wealth, and then there's health, right? Time, we can't make it back. It's gone, right? With financial wealth, you can always borrow it, you can make it back, and we sell time for money and we buy money with time, or the other way around. But with health, there's just this one body, physical body that we have, and you can, I'm sure you'll talk more about it, but it's not just the physical but it's also the mental and so on, and we'll talk about the stories that you share in your documentary. But it's just one, right? This is it.
Yeah, and of course you're seeing a lot of money being thrown into the idea that maybe we can reverse aging to some degree. And I think there's a lot of controversy around whether aging is a disease, is it a symptom, is it just a natural part of life that we shouldn't be trying to fight? All sorts of great conversations, great debates around it that we can get into. But there is this notion, there's this small camp of individuals who believe that you can perhaps reverse time to some degree. I mean, not literally reverse time, but reverse time in terms of aging. I fall in the camp that I do believe that there are ways and methodologies to be able to delay the rate of progression of aging, which is different than reversing aging.
Mm-hmm. Before we get to the stories and everything else, I want to ask you about one particular story that you share at some point of your grandfather, because you're not the first doctor in your family, and you tell the story of your grandfather. Could you retell the story for the benefit of this audience, how it inspired you?
Yeah, so my grandfather was, he was, during the time of the partition when India and Pakistan were sort of at a war with each other when the British had left India. My grandfather was both a politician as well as a holistic doctor in Amritsar, India, which is sort of at the border of where Pakistan and India now lies, maybe about 30 minutes from the border. And so there was a lot of fighting occurring in that area. And at that time, he decided to essentially open up a free hospital and a free clinic to basically serve people of all kinds. It wasn't specific to just Indians or to Muslims or Pakistanis. It was open to everyone. And of course, that itself drew in a lot of controversy. And a lot of hate from either side. And so he ended up, doing it sort of in secrecy. But over the time, the facility was essentially, attacked. It was torn down. There was a lot of crime around it and so forth, and trying to stop the facility just because it was serving, people of all populations. But that was really sort of my first understanding and take. And these are stories that were shared down from my father. It's really just about serving humanity and serving individuals and looking at everybody sort of with an equal lens, regardless of whatever our differences, our colors, our creeds, our beliefs may be. And that really got passed down to my father. That really left an impression for my father. And this is my grandfather on my mother's side. So they were really close. And that was the influence that my father had to become a physician himself. And so he helped resurrect that hospital in Amritsar. And now my cousin actually is running the holistic practice out there. So it's moved on from generations, but it's still nice to see that ethos, that belief of service and giving back still sort of runs in the blood of our family. And it's one of those things that I hope to pass on to my children as well, whether they're in the health field or not. I think that viewpoint and that element of being able to serve and be able to give back to the community has really been sort of a thread and a lifeline for our entire family.
What I hear, it's this higher calling. You have the skill, you have the experience, you have the expertise, and you want to help people. My wife and I recently met a hospice doctor who's working with a lot of patients these days that are struggling, and the way she looks at it, she's helping people that can pay for the service, and she's helping a lot of people that cannot afford it. And it's her higher calling, and we met her and we spoke a lot with her. And it's very, very moving, because I saw it in my parents, how they would go out and help in places where they couldn't bill. There was an accident on the road and my dad would just get out of the car, walk over and help. He would never charge for it. And it's as a profession, it taught me so much, and it helps me in the investment profession, where I go out of my way to help clients. And somebody would ask, how can you bill for it? I can't. I don't need to. I just want to help. And I think we all could benefit from that kind of thinking in any kinds of pursuits that we have, that you go out of your way, not thinking in terms of a billable hour or an invoice, but you know how to help. Why don't you?
Yeah, that purpose, that meaning, that calling. I'm a firm believer that if you put good into this world, the world will give back in many different ways. That may not be now, maybe it's something later on. And I think there's no greater selfish act than the act of giving, because it really is a self-fulfilling, purpose-driven act. And in fact, it's funny now that we're looking at some of the signs, things that are coming out of blue zones and some other areas. The number one factor for longevity or living a better health span in terms of your lifespan is having both purpose and connection in life. So I think it's something that we underestimate in a variety of all the things that we do.
I want to ask you in a second about prescribing stories instead of pills, but you brought up the term holistic, and I'm very curious about it because my wife and I had interacted with doctors recently about something, and I realized how a lot of the questions in some interactions go towards, what's the pill that you can take today to take the problem away, instead of asking why did this problem even occur, and that invites a whole more interesting conversation. And I can apply it also in my work where deeper questions bring more interesting outcomes than just going after what's the immediate solution. But your grandfather was focused on holistic, and you're just bringing it up. Can you talk more about it, how medicine is trying to treat things in a certain way, and maybe there's a more open-minded way of looking at things that are not necessarily just one pill that fixes everything?
Yeah, I mean, we're a system. I mean, there's so much to really dig into here that we can unpack. But yes, I once prescribed pills, and now I prescribe stories as a form of medicine, is sort of what I like to say. As doctors, what we're trained, we're essentially drug dealers. And it's not because that's just, the way the system is done. It's just because of the way the incentive structure aligns in healthcare, where we historically are taught to treat symptoms or treat diseases. And so there's got to be some sort of intervention that you can do, and then you pay for that intervention. And the system is sort of been built off of that type of process. It's called allopathic medicine. But we know that when you look at sort of Eastern practices of medicine, Ayurvedic, holistic types of practices, that there is some rationale to some of those natural remedies and ways of being able to look at health. And so I think what's really interesting is we're starting to see this conversion of Eastern medicine and Western medicine come together in a variety of different ways that we can sort of dig into if you want to. But at the end of the day, I like to sort of simplify medicine down to its core basics. And you talked about this element of storytelling. All we're doing is essentially, we're changing the narrative of somebody's story today, and whatever that might be. It might be poor mental health, it might be some sickness, it might be a longing to live longer, whatever that story is. And we're transforming that into something better tomorrow. And the methodologies and the tools and the modalities and the techniques and everything that we use to get from point A to point B might be different. And it does involve a variety of different things. It could involve things like pills. It could involve preventative things like more holistic approaches or Ayurvedic approaches, for mindfulness and purpose and things that you can't necessarily measure or track in a traditional sense or perhaps get reimbursed for. So it really encompasses a variety of different tools that we can use in sort of changing that narrative for the individual from point A to point B. And some of that also involves, for example, factors that you're involved with, our financial health and our education and our mental, so many different factors that play into that. That's why I like to consider it as sort of a single asset. Like, how do we approach it with that plan in mind?
You might know more about it than I do, but I realize that stress is behind a lot of the problems that we experience. And then money is number one reason for that stress, right? So when somebody shows up in your office at some point and says, I'm getting headaches, or I can't sleep, or I have stomachache, yes, you can prescribe things for those. But you realize you could ask a few more questions, and maybe they're going through some career transition. They are afraid they won't be able to pay the mortgage, or something else is happening in their life, and you can understand a bit more, right? So you're going deeper and deeper layers away from what you think the problem is. And we're not trained to do that. So it's really interesting because we have the expectation for our physician or our providers to essentially ask us those questions or think about us and from that perspective, but we're not really trained to do that. We're trained to essentially treat symptoms, treat disease. So I mean, if your doctor or health provider doesn't ask about your sleep, doesn't ask about your health or your eating habits or your movement habits or your connections and social environment, they're essentially just drug dealers. And so you need to
think twice about whether that's the right physician for you or not. And make sure that they're actually looking at you from a holistic picture. Sorry, I interrupted. I think you were going to ask a question there.
No. I like the way you explain it. I feel like in many professions, we're not trained to do it. Even in my profession, I'm supposed to be turning 1 million into 2 and 2 into 4 and 4 into 8. But I realize...
You mean you can't do that? You can't do that, imagine?
It takes time. But... doing it for 20 years and spending so much time with wonderful clients and fascinating families with incredible stories. Speaking of stories, I realized that the questions can be so much more interesting than the one turning into 2 to turning into 4, and appreciating that money has an impact on people, and lack of it or presence of it, inheritance that comes to your life at a certain point in your life, it's disruptive in many different ways. I hope it's more of a blessing than a curse, but acknowledging all those things, and it has an impact on all kinds of well-being, including mental and so on. So I think it's worth asking those questions. And I'm not sure we're trained to do that, but it naturally comes when you're just curious. And I met doctors, comparing the two professions, where doctors actually ask those additional questions that help us go away from the headache and realize what really caused the headache and what can we do not to have that headache again, instead of relying on that pill to take it away.
I tend to, if you can't tell, I tend to borrow a lot of terms from the financial industry, because I do see a lot of overlap and congruences with the healthcare. So, one of the, I think it was Warren Buffett or somebody said, or I don't know who said it. The eighth wonder of the world is compound interest. Maybe it was Einstein, Ben Franklin, someone who always gets credit for stuff like that. But the same thing applies in health, right? So, compound interest on the habits and behaviors that you do today have impact down the road, or consequences down the road. And so there's a saying that I often say is your biography becomes your biology. And so if I unpack that a little bit, your biography, the way you live your life, the way you feel, the things you do, the people you interact with, the things that you put into your body, how you move around, how you stress, how you don't stress, it almost like leaves a little blueprint or a little imprint on every aspect of your body. And that essentially informs and changes your biology over the course of time. And so when we think about, how do we essentially optimize for our health down the road, compound interest is perhaps the greatest tool that we can use to reduce friction between those things that we want to create good habits for, and increase friction for those things that we want to decrease bad habits for, and then compound those over the course of time, and you're going to see results. We live in a society, like you said, you're being asked to 2x, 4x, 5x, and income for individuals and investments. But we all know that those quick hacks and those quick fixes are far and few between, and mostly driven by luck. The real success, what you see people down the road, in a good financial state or in a good healthy state, have understood this concept that it takes time, and you need to build in those good habits, whether it be financial habits or health habits, over the course of time. So your biography becomes your biology, and it's done through the technique of understanding of compound interest.
There's something about the feedback loop, both in the investment world and with our health, that we don't see the consequences for a while. And compounding works that way because the incremental growth over 5 years is not that impressive. Over 10 or 20, it can get really impressive. And I think we can get away with things in both situations where, it's a terrible meal and no activity all weekend, no consequences on Monday, especially when you're 22. But then at some point you realize, I'll have to pay for it.
All of a sudden you wake up, you're 40 years old, and you've got back pain, and you're running after your kids, and you can no longer move the way you used to. And it comes up pretty quickly. It's funny, I saw an interesting report that came up recently that said, we don't age linearly. Like there are inflection points in our aging process, somewhere in your 20s, then I think somewhere in your 40s. And then, there's probably something in your later years as well, but it's no longer just a gradual decline. It's actually a drop off point at certain, and I'm sure it's different for individuals, but it's an interesting notion to think about. It's almost like dog years, that it's no longer, every human year is 7 dog years. They actually think that it's sort of an S curve where it's steeper at the beginning and then tapers off.
I'm sure we'll come back to it, but I'm curious to hear about the stories. You don't want to prescribe pills. You want to prescribe stories. What kind of stories would you prescribe?
So I think, we started this show to sort of test out this philosophy or this belief that we can use stories as a form of medicine, as a form of healing. And it really came about accidentally. I had a pretty substantial injury on a trip in Africa when I was on safari, and we were there with the family for a charity-driven trip. And within the first couple of days of the safari experience before the charity operation, I ended up with a knee injury that I had to be medevaced out. And so that was sort of a long story. We can dig into it if we want. But I ended up going to an event afterwards, and somebody asked me, they said, listen, G, can you just share that story about your trip to Africa? And I was like, why would anyone even care about that injury? And it was a very harrowing story and eye-opening, and there's a lot of great mantras and philosophies and things that I took out of it over time. But what I realized in that process is I delivered the talk, and it was like, it's probably like an hour-long story, but he's like, I want you to deliver it in under 5 minutes. I'm like, oh, fuck, how am I going to do this? So I ended up doing it. And what happened afterwards, when I came off stage, the story was never about me. The story was about the other people who were listening to it. And people saw themselves in the story that I shared. And so what happened when I came off stage, I realized that we share stories not because we want our story to be told, but we share stories because other people find connection in it. And so many people, just through my story, started sharing their own personal experience. And that, to me, is the power of story. And when you start to look at health, which is a very personal thing, we tend to feel very lonely. We tend to feel like, I'm the only one experiencing it, even though we know millions of other people are probably experiencing something similar. Maybe not exact, but something similar. And so we thought that of this notion of, could story be used as a form of medicine instead of pills? And could it be used as a form of healing? And so we designed, from ground up, this audio docuseries that we called SUPERHUMANS, with sort of our own signature storytelling methodology style, to figure out whether that is true or not. And it clearly is the case, because in having produced, the first season of SUPERHUMANS, I was literally getting texts and emails and calls from individuals saying that story that was told has changed my life, has saved my life, has made the biggest impact, has turned me around. And those are the types of things, that was not a project where I made any money from it, but it was probably the most fulfilling thing that I've ever done in my entire life.
Isn't it fascinating, like a big picture idea, that we go through life, we have all kinds of careers, pursuits, and then we look back and we realize that the things that brought us the most fulfillment, joy, satisfaction are the ones that we were not actually paid for.
And oftentimes they come up accidentally too, right? Like, there's something that's unintended. Like, it's not like I planned it to be this way. I mean, we had a seed of an idea. It was around COVID time. We were trying to figure out how to, develop our own style. And it just sort of accidentally came to be. And those, I think, tend to be some of the most gratifying types of projects, to your point.
And you touch on something really fascinating, which I notice in my profession, that people experience substantial wealth or sudden wealth or inheritance or all kinds of stories, but they think that they're the only ones that this is happening to. It's just like with other stories regarding health or mental health specifically, as you brought up. And then this podcast was an opportunity for me to bring people to talk about it, because the response is really heartwarming, and people realize, well, there are people on the other side of the globe going through the same thing with their own family. They're not the only ones. And the other benefit is that somebody has already made a collection of mistakes on one front. Why not learn from them and go about it in a different way yourself?
Wonderful point. Yeah. And we try to, even when we're very intentional about the way we convey these stories, because it's funny, the superhumans, they're the storytellers, and we call them superhumans because they're willing to be vulnerable in sharing their story to be in service of others. And oftentimes when we hear our struggles and we hear our stories, we're not really happy with that, right? Because it's a maybe a frustrating point of our life or something, but they know that when they share their story, they're being in service of others. And so what we try to do is not make it specific to any individual. So even when you look at the title of our episodes, we never give a last name. Even if the person is a celebrity, we'll never give the last name. So we'll say Alex's story or, Christy's story. And we purposely do that because it makes it a little bit more relatable, right? It makes it a little bit more like anybody, that Christy, that Alex, that could be me. And I can see myself in that person's seat. I may not have the exact same story as they do, but there is a common universal truth that is part of the human condition that we all grow through. And if you can find that element within the story that is the truth within the human condition, even if, for example, if the story is about addiction. Now, I've never suffered from addiction, but the story beyond addiction is really just about finding a place to belong. Well, can I relate to that personal truth? Absolutely. And I think the same holds true when we look at stories in other sectors as well that aren't necessarily about human transformation, but perhaps about our financial stories.
And I think there are at least two big benefits. One, somebody gets to share it, and it's so much easier and lighter to actually share it, to create that space, the container for that story, a vessel, to be present, because you might be holding on to a story and never have an opportunity, the time, the situation to share it. And then other people hear it and they realize something like this could have happened to me or has happened to me. And there's something, a connection or something that we experience as humans that makes us feel a bit lighter about it, that other people have gone through it and they handled it and I can handle it. I think there's something empowering about that, and recording those stories and sharing those stories, I think it's a huge gift.
I mean, we opened up this whole conversation with you asking me about my childhood story, my grandfather, all sorts of different things. And what we can tell is, these stories shape who we are. They shape what we believe. They shape what we think. And they're the stories that we tell ourselves. And you have the ability, it's a little bit like revisionist history. Like, we all probably have a version of what that story is in our head. But we have the ability and the power to reframe it in a way that it actually can create a positive outcome. And if you're given permission, you're given that space to allow for the reframing of the story that you tell yourself can actually have a significant impact down the road. Now, I could have looked at that story, for example, of the partition of my grandfather opening up the hospital and looking at it from a frustration or anger standpoint and saying, oh, why would these people attack this hospital? It's meant to be good. No, but I looked at it from a positive standpoint, and it was meant to serve to unify a population, right? So you can always there's always multiple truths to a story depending on what perspective you're looking at. And I think the real power of the story is the ability to have your interpretation of that story that has meaning to you, that then shapes your life going forward or shapes your conversation, your beliefs going forward.
Well, I'll bring it up that I spoke with Dr. Jordan Grummett, who is a hospice doctor too, as the friend that I was telling you about. And he told me about this idea, when you tell yourself stories, you can be a hero or a victim. And it's a theme that I've heard in other places, but we talked about people towards the end of their life and they're retelling their stories of their life. And when I hear you, I feel like I'm also thinking in terms of, how do you describe yourself in that story? Are you the victim or are you the hero? And I think that's very empowering to see yourself, obviously, more as a hero than a victim of things.
I'll add another layer to that. I don't see myself as either the hero or the victim. I see myself as the vessel. And so the story, if I were to see myself as the story, it's the same reason when I give keynote talks or I give presentations or things like that. You're told the hero in the room is not you giving the talk. The hero is actually the audience listening to you. And so all you're trying to do is essentially transform, someone's thought process from A to B based on whatever you're sharing, from a story, from a talk, from a keynote, from a podcast, whatever it might be. And so if you see yourself as the hero, that's essentially selfish. But I think the true storyteller is actually not meant to be the hero. The hero is the person who's listening to it on the other end. You're just the vessel to get them to think that way. And neither am I the victim, right? If I'm the victim, then I definitely don't see myself as a victim in the story. But, storytellers, I think, are vessels and less so heroes or victims.
I like that. That adds another layer to it. I'll be thinking about it. But speaking of talks, I gave a TEDx talk at some point, and I was active with Toastmasters, and I greatly enjoyed giving talks. I think there's something empowering about it, and it's different than writing. I write articles, I wrote books, and I'm hosting a podcast, but standing in front of an audience, talking, being that vessel as you described for the next 10, 20 minutes or an hour, there's something special that happens. And what I like the most is what happens right after, when people walk up to you and talk to you and share stories with you. You've given 300 talks in 30 cities from what I know. Can you talk about your experience of standing in front of the audience, telling a story, and your public speaking journey?
So I'll take back my notion before where I said I've never been addicted to anything. If there's one thing I'm addicted to is the idea of speaking, and I'll tell you why. It is maybe it's just sort of part of my upbringing, my genes. And I used to, be in a band, and I host in club parties and things like that. So I sort of loved being in the presence of other people and just seeing people transformed and happy. And I think now, as I'm older, my modality of doing that is by sharing messages and giving talks and being on stage. And but there's something really powerful about the element of sharing your ideas, your thought process, and seeing people in real time shift their ideas, shift their thinking, transform them. Like, that power is really it's both humbling as well as extremely fulfilling to see that you've changed somebody's opinion or mind or belief simply by the stories that you shared over on stage. And I fell into doing this accidentally, by the way. So, I used to, I've had a storied career through entrepreneurship, running companies, of course, a medical doctor, business background, public health. I'm also a certified interior designer. But over the course of my career, I've done a variety of different roles, which culminated into essentially me leading and being sort of an innovator in a space as chief innovation officer for a number of companies. And that to me is actually all about storytelling. But I have a very unconventional way of the way I practiced innovation. And so I accidentally ended up on the speaking circuit, got picked up, like you said, probably same thing with the TEDx. And, that essentially opened up a lot of doors for other things. But what's really addictive for me is that, you meet the most interesting people, right? You're surrounded by other great speakers on stage. So I'm a voracious learner and reader. So I'm always curious. So it's to be surrounded by new ideas and new thinking and other people sharing their ideas. And then to be able to get up there and have the privilege and honor for people to allow you into their lives and to be able to change their minds. Mm-hmm. That's a real privilege to be able to have that. And when you can see that live transformation, you may not move the whole room, right? You don't have to be Tony Robbins to get the full, transformative power and changing a whole room. But even if it's just a handful of folks that, like you said, you come up to afterwards, and they're just like, that is, I used to think this way, but now I think this way. Or I'm going to go back to my work and I'm going to change the way I do things because you really inspired me to do it differently. Or I'm going to change the way that I communicate and interact with other individuals. It can just be the smallest things. But like we said, those small things over time create compound interest and can actually create the ripple effect in that drop of ocean that over time then influences who they interact with and they interact with and they interact with. And so the power of that story on stage and delivering keynotes actually has impacts and effects that we will probably never be able to see or measure, but just know that it exists because other people are then sharing that beyond what we shared.
So many questions. I'll come back to innovation and the status agitator that you call yourself in a second. But I'm thinking in this world that we live in that's becoming more digital, virtual. You can watch somebody's lecture. The most, the most popular history professor that you want to have, you can download the lecture and listen to it. But being in the room, and I spent quite some time like you did at different universities getting degrees, but I have memories of individual lectures when somebody came to speak or my favorite professor would speak. And the level of retention and the level of how much of an impact what I heard had doesn't compare with me watching a lecture on a computer. And I know that maybe that's the future, but I'm curious about your thoughts since you love the experience so much. I hope that this kind of delivery that was with us, has been with us since Plato, will continue and probably continue in the future.
I think I 100% agree with you. I think one of the greatest elements of transformation or change requires feeling. And feeling, through a screen versus being in person, it's just not the same. And it never will be. There's no way that you can replicate in-person feeling, touch, vibes, smells, scents, all that stuff through a screen. And I think that has a significant impact in terms of how we perceive and how we receive information, not just perceive but receive information, how we process that. Mm-hmm. Otherwise, so for me, I don't get the same thrill of delivering talks online. Now, I understand circumstantially or logistically, that's the only way it can be done. For certain cases, but if I had my preference, it would certainly be being in person to be able to get that feeling that you just can't get through a screen.
when you're on stage, you see people's facial expressions, you see their body language. You have so much feedback as you speak that as a Zoom call cannot replicate. Although I try to pay attention to how people respond, but I don't feel them the same way I do. It's a little, head shake or a gesture, or they fix how they sit in the seat, and you can tell this was a bit uncomfortable. I wonder why. I'm curious if they'll walk up to me after I speak.
Watching a Broadway show online is not the same as going to a Broadway show, right? They're not, and there's a reason why they don't replicate that. Like, when was the last time that you watched something on a screen and you just got chills down your back, right? It's very rare for that to happen. But when you're in person and you feel it and you sense it and there's people around you, there's something that is in the air that you can't capture across a screen that gives that element of feeling. I think leading with feeling is probably one of the most important things. Even when I design my talks, or I design innovation, or I produce a show on Superhumans, or I design a home, the number one thing I lead with is, what's the feeling that you're trying to capture? And then you reverse engineer from there. And sometimes you just can't do it through a screen. Most of the times you just can't do it through a screen.
Well, I find video calls and all that very empowering, and I think it has changed our lives in the last few years. And I think even being able to host this podcast I'd love to travel to see every guest and record it in person, but it's physically and financially probably a big hurdle. But with clients, for example, I see how once a year I try to see everyone in person, and that hour or two, lunch, coffee, dinner, when we talk about things that are not necessarily portfolio or investment related, but everything else that gives me context, I value those interactions as very, very important to me, because they fill in all the gaps that a Zoom call might miss. And it's the subtle things, the subtle comfort, discomfort, all the feedback they give me, just the same as when you stand on the stage and give a talk. And I hope I can continue that, as the business grows, that I can sit down with people at least once a year and feel, not just know, but actually feel what's really going on.
Yeah, and I love all these technologies. I think they're great. I think they serve certain purposes, but at the same time, I think they're also hindrances on certain elements. Where we're seeing this epidemic of loneliness across the country, and I think some of these technologies are actually contributing to that. Right, the system to some degree is rigged against us. Like, we tell people to connect more, to meet in person more, and then we give them more digital tools to prevent them from doing that. We tell people to move more, and then we have them sitting at desks. We tell people to eat better, and then we just stock their pantries with junk food, right? So the system is essentially rigged against us, and I think this whole notion of in-person elements is the same way, right? It's becoming easier, more efficient, more cost-effective to utilize these tools, even though we know the probably better and right thing to do is to try to get in front of your customer, whoever might be your clients, in person. And I try to do the same thing. Like you said, I try to get in front of them and be with them as much as financially and feasibly possible.
And it goes back to the relationships and the connections that you brought up before. Obviously, we can maintain them over calls and video calls, but we do need that. I still do, that in-person element to keep it
I'm
alive.
with you on that.
I want to talk about innovation. You brought it up briefly, but you're obsessed with the topic of innovation, and you call yourself a status agitator. How do the two coexist, and tell me more about it?
Well, innovation is fundamentally all about change, right? Mm-hmm. And so you can't, the status quo agitator is all about how do we find and agitate, and not saying that you have to force change, but you can agitate to say, should we re-question, should we be rethinking, reimagining what the possibilities are? And so I've always looked and viewed the world from the lens of curiosity, like what can we be doing differently to make it better? It's funny. So as my background, I was, somewhat coming from sort of a philosophical standpoint, because I was a creative writing and a poetry major, and an English lit major in college. And that really had a lot of influences in terms of how I think about and view the world. And so there's a phrase that says poetry is the uncommon arrangement of common words. And so very simply, I've modified that to say that innovation is the uncommon arrangement of common ideas. Mm-hmm. And you just have to be skilled enough or trained enough to be able to look at the world from a very different perspective to see how you can arrange those common ideas in new ways to create innovation. So it's very simple, right? Very down to the bare, you probably see a common thread here. I like to sort of break things down to the most simplistic elements as possible here. And so, yeah, so, innovation to me is this fundamentally about change. And so I consider myself to be the status quo agitator because I cannot sit still. And I'm always going to be looking at, what are some ways that we can optimize it for a better outcome tomorrow? Again, back to that narrative. If it's about change, it's something today. Is there a way to make it better tomorrow? And the answer in many cases may be no. Maybe innovation is not required here. But if you do truly want to drive innovation, you have to be looking at that fundamental ability of change, which is a narrative from something old to something new.
I like this idea that change is the only constant, and I see it in the investment world. You could say, oh, let's buy those 5 stocks and hold them for 100 years. But we know that businesses come and go, industries come and go, consumer behavior changes. Even in the last 5 years, the pandemic sped up some changes in how we shop, consume, and get entertainment. So it's all subject to change. So when I think of innovation, I'm also thinking of keeping up with the change. How do you think about it, both as a consumer, as an investor, as a human being? How do we keep up with it?
Well, it's funny. There's actually a slide on my keynote talk, and it involves a little bit of cursing, but I'm just quoting my talk. So there's a graph that shows the pace of change, right? Our pace of change is growing exponentially,
right?
And our ability to keep up, we have an inability to keep up with that pace of change. And that gap that I show on that curve is what I call the oh shit moment. And that's when leaders of organizations are like, oh my God, we can't keep up with the pace of change. What are we going to do? And so we end up falling into a trap that basically goes down this path of seeking the shiny new object or looking for best practices, right? So these are things that are essentially very dangerous in the world of innovation and competition, because it breeds competition versus creating something new. And when you get into the world of constant competition, it becomes a zero-sum game. And so you need to be actively pursuing the idea of value creation versus competition. And so the shiny object syndrome is like, what's everyone else doing? Look at this new AI tool here. Look at that over there. Well, maybe we should be playing in this sector because it's the new sexy thing that everyone's talking about. That can be very dangerous because it's very distracting. And so you really have to look at fundamentally, what are the areas that you should be pursuing for change, and to be innovating. But yeah, we fall into these traps all the time, and we have to essentially, the way to get out of it is you have to build a culture that's willing to have these difficult conversations and to think differently. And that's kind of what the premise of my main talk is. So
what's the handful of hurdles, problems that you see that could be disruptive now, and then lead to more innovation and more improvement? Do you have a handful that you can give us a flavor of?
Well, I can give you some ways to think differently, like a contrarian mindset. But before I do that, I think the biggest hurdle is not for a lack of ideas. And I oftentimes like to say that, bad ideas are just underdeveloped good ideas. You can always massage and develop an idea in multiple different ways. But I think the biggest hurdle to progress or innovation oftentimes comes down to people, right? We as human beings, the human condition, we are designed naturally and biologically in a way to seek comfort, safety in numbers, right? We're tribal people, right? It goes back to the prehistoric days that we all surrounded and protected ourselves from the dangers of being eaten alive, right? In the wild. And so it's no surprise that our tendencies tend to do the same thing today. When we're in the work environment, we tend to sway to things that give us comfort in numbers. And so people become the biggest obstacle to change and innovation. And I like to describe it in sort of 3 different ways that describe sort of this cultural quagmire. And we all have these individuals in the companies. There's the chameleon, there's the ostrich, and there's the sea squirt. And so the chameleon, I think you can guess, it's the individual in the organization that says, I'm just going to blend in, go unnoticed, and hopefully they won't ask me to do anything. So we know those types of individuals, right? They're really not really productive or helpful in getting things done. We also know the ostrich, right? So the ostrich basically puts its head in the sand. It knows what's going on, but it tries to ignore it. If I ignore it long enough, maybe they won't come after me, or maybe it'll just go away on its own. We know the ostrich. What people don't know, and I think is probably the most dangerous of them all, is the sea squirt. So the sea squirt is a water animal whose entire job in life is, from the day it's born, is to find itself a shell in which it can live. And once it finds itself a protective home, a protective shell, it literally eats its own brain. Like its job is done. And so there are people in organizations who are so rigid to change that they say, here's our strategic plan. Once it's set, it's set. This is what we're going to do. And I think these are the most dangerous of all people, because they're not only not open to change, but they try to resist change when change is needed. And so I think people, the C squared specifically, are the types of people that we have to look out for the most. I mean, we can get into some of the tools in terms of what are the contrarian mindsets and things that you can do. There's a whole host of them. You tell me what path you want to go down.
No, how do we disrupt that? It sounds like it's a serious obstacle, and I've seen it. I know what you're talking about.
Yeah. Well, I mean, I think it starts with the seed, right? So this is why I give, and it's a very effective talk in front of individuals, because it starts with those few people who get moved, and you give them the toolbox, you give them the ways to think differently, and then they now become that conveyor of these ideas, that agent of change inside of their organizations, right? And if, essentially, if you're one of the leaders who has the ability to create and make those decisions in the organizations, you can then structure it in a way where you can now take advantage of all the great innovations that should come from the entire organization. Innovation doesn't come from an individual. It doesn't come from a department. It comes from an entire company. And so you need to essentially figure out how to change the mindset of the organization so that they can all contribute to it individually. And so some of the things, for example, will include, let's say, living in their reality. And this is one that I not just talk about in the world of healthcare, but overall, when we're in our world of whatever widget that we're producing in our companies, we tend to think that everyone is consumed with that element of their life, right? But the reality is we all live different lives. And in that lives, it requires, taking our kids to school or worrying about finances or what are you going to eat on the table. So we have to look at the context of what we're innovating in the reality of which those humans or those target audiences are living. And only then can you truly innovate from within it. So you got to shift your mindset from what's the greatest product that I can create to what's the product that I can build into the experience of the people we're trying to serve. And, I've gone through business school, and I think the number one thing that we're always taught in business school is first identify the problem and then try to figure out a solution to that problem. And there you go. Voila. You've got your great company. You've got your great thing. But that's not truly the case, right? We can build great things that nobody uses.
True.
And so you have to factor in the layer of what is the experience that individual is leading in. So it's not just about problems, products, solving for problems, but it's about experiences built for people. And I think that's a little bit of a missing equation. And living in the reality and understanding that helps drive that context. That's one way. There's another way of doing it, what I call sort of find your small acts of meaning. And small acts of meaning, the best way to sort of share what this means is sort of put it into example. There's a thing called, for example, the IKEA effect, right? So they did a study and analysis on individuals where they said, you've got this expensive piece of furniture that you bought, or you've got this IKEA furniture that you bought at a fraction of the cost, but you spent hours figuring out and how to put that thing together. And when they came down to the question of what do they think they valued the most, it wasn't the expensive piece of furniture. It was the thing that they actually had meaning towards. They put their sweat into building that piece of furniture.
Yeah.
That they valued it a little bit more. So when you think about innovation, you think about building the experiences, how do you create those small acts of meaning, right? Starbucks, I mean, they've lost their way a little bit, but Starbucks for a number of years understood that, right? The little name on the side of the cup, it's the, teaching the baristas to call out your name. You felt like you were special. You could customize your own drinks in your own unique way. These are small acts of meaning that create loyalty amongst your customer base, that even if somebody were to produce the exact same cup of coffee,
right,
you've just won them on that loyalty from the small acts of meaning, right? So another way to sort of think differently in the context of innovation. And I've got, 15, 20 of these different things.
There's so many interesting points that you bring up. First of all, the ideas are out there, and just using them and deploying them and sticking to them, it's very tricky and hard. And you run into people, and I think that's true today. It was true 50 years ago. It was true 20 years ago when I got started. I remember trying to introduce the firm where I worked at the time to a new software. And believe me, it was one of the hardest things I had to do. And the backlash was quite interesting. And somebody told me, one of the senior people there told me, what is it that you can do with this software that I couldn't do when I was your age with a pencil and a legal pad? And, and I said, nothing. He said, why do you need it? I said, well, because I can do it in a fraction of the time. And the competition is doing it in a fraction of the time. So if you make me do it with a pencil, you know the outcome. So fascinating conversations that I had to have at a young age. And I realized I'd love to stay as open as I was to innovation and change and new tools as I was back then. And I hope I'm trying to keep up with it as much as it's possible, because my industry has changed so much. I remember visiting the New York Stock Exchange 20 years ago, and it was the last days of paper tickets. And one of the floor traders told me, hold on to this, because these paper tickets will go away. And he was right. Not only the tickets went away, the floor traders went away. Brokers. And it's a computerized experience now. Computers are humming, and it's a quiet space. It could be a library. It's none of what you imagine from the movies from the 80s today. So change.
It's funny you say that. I have a collection. If you look behind me here, and I'm trying to point to certain things, I have a collection of mementos from my childhood, from old technologies, from things that are sort of, reflective of sort of an old period of time that was something so special. And it's a cabinet that's filled of all these things. I've got my old Atari in there. Here's a Mr. Potato Head that I'm pointing at. You can sort of see a childhood little phone thing that we used to have that resembles the old phone. So there's something very nostalgic, and it's disappearing, right? It's sad that those elements are disappearing. But again, these are some new stories that we can tell ourselves for future innovation, for future generations.
Well, it's a perfect way to talk about homes and wellness sanctuaries. You're showing us your home, your shelves, and I know that you spend quite a bit of time these days thinking about how you design that space around you. And I think it's very important, the environment we operate in and how it influences us. Can you talk about that too?
Yeah, so I've sort of evolved. My career, of course, has just been a series of steps following paths of curiosity, and one of them's led me down to this notion of how do we look at our home as a vessel for health promotion, disease prevention, and allow us to age gracefully. And so we started this thing called the Well Home, which really designs spaces that embody health, longevity, and well-being, and really meant to sort of optimize our health in the space that we spend most of our time, right? We spend over 80% of our time, especially post-COVID, inside of these four walls. We spend a bulk of our money inside of these buildings and these homes that we buy. And yet no one has ever looked at them as a vehicle to optimize our health, right? It is the location that we eat. It's the place that we sleep. It's the place that we move. It's the place that we socialize. I mean, all these different factors, which we know are the most important factors to our health and well-being. No one's ever looked at it from a health perspective. And so we're trying to change that in some of the things that we're doing. And unfortunately, the way this sort of came about is my dad had Alzheimer's. And so being the medical family that I talked about earlier that we are, and he was a physician himself, we got him the best medical care that you could get. But what we quickly realized is when my parents moved in with me and his condition severely worsened, that most of his outcomes and most of his quality of life was tethered to how he lived inside of our home. And I took my own sort of medicine where I said, let's live in their reality. And so looking and observing my dad and living in his reality in my home was very different from the way that I was living inside of my home. And so if I tried to force fit it into my world, it just would have been a world of frustration for both him and myself and the rest of my family that probably would have progressed the disease and further. But what we recognized was there were simple things around the home. In fact, there's over 100 things that we look at when it comes to looking at a home for dementia patients. That we can alter or change or improve depending on your specific situation that can move the needle in optimizing for health outcomes. And we saw the significant difference all the way from quantitative measures of his medications going from 12 a day down to 3 with improvement of symptoms. He was more with us, but more importantly, he was happier. He was part of us until his very last days that he passed, versus sort of being this zombie that lived in sort of this other room that we were caretaking, right? As now he got to experience his last days as being a part of the family and being with it, and we could design for that. And so really that's how we thought about, our lived spaces as a tool to optimize for health.
Can you give us an idea? What are the things that we can even do around our space, or what you've seen that worked for people?
Yeah, I mean, so there's a whole host of different things. Right now, I shared sort of the idea around working with conditions. And if we do that, then we have to get a little bit more context specific. But we do work with people who have, chronic conditions, oftentimes lifestyle focused conditions that we can modify. But if you have allergies or arthritis or heart disease or diabetes or cancer or things that we can go in and we can alter and tweak depending on your specific situation. But I'll say one of the biggest factors that people don't realize that they can maneuver is your sleep. We know that a majority of people are struggling with sleep. When you look at eating properly or exercising properly, like those tend to be the two big things that people focus on. But from my standpoint, if you don't have proper sleep, eating well and moving well are kind of moot points, because sleep is the way your body ultimately processes the things that you eat, the way you move. And it's sort of your healing and recovery process where you build up your immune system, you metabolize the food that's in your system, you create a sense of autophagy, which is basically eating up and removing some of the toxins for your body. So if you don't have proper sleep, none of the other stuff really matters. And so people often think that sleep is just, well, I woke up and I felt great, or I didn't feel good. And that's my gauge of sleep. And I've got, I wear the Oura ring. I track as much data as I possibly can to really understand what are the things in our environment that we can control and perhaps change to optimize for sleep, right? So we may not be perfect in the sense that, we eat all the proper things every single day to get proper sleep. But there are certain passive things that you can do around your environment to assist with it. So, for example, try to maintain, if you're not out over the weekends or things like that, try to maintain consistency. Sleeping at the same time every day, waking up at the same time, even, giving yourself a 15 to 30 minute window that you do that on a consistent basis every single day. I don't even set an alarm clock. For me, my biological clock is just set every single day where I get tired around the same time and I wake up around the same time. I use blue light blocking glasses. In fact, I have those right here that I wear to after 5 p.m. And it blocks out the blue light. And so you basically have these yellow, it promotes the red light to basically tell your signal to your brain that it's time to wind down and time to sleep. So these are sort of, wind down methodologies that you can use. I tend not to eat within 2 hours of going to sleep. You could slowly move that up 3 hours, 4 hours if you can, but whatever far you can. If your body is trying to metabolize overnight, it's focused on that. Your body is not a great sort of multitasker. I mean, it can multitask, but you're not going to get the best out of it. So if your body's now focused on trying to digest what you just ate before going to bed, you're probably not going to get the best sleep as a result of that. Obviously things staying away from caffeine, everyone's genetics are slightly different. For me, I've actually tested my genetics. I don't drink caffeine after 2 p.m. Some people can tolerate that and have it, even for dinner and sleep okay. It's very individualized. We control the temperature of our room. So the ideal temperature is typically between 67 and 69 degrees to optimize for sleep. Now that's based on sort of universal standards, and I know everyone's going to be different. My wife, for example, can't stand it that cold. So what we do is we keep the room cold, but she has a heating pad that she'll keep next to her. If she does want to warm up, she keeps that next to her. Or you can layer on clothes, right? So you can layer on some clothes to keep it cool. Or you can there's great products that are out there that you can actually create a specific temperature control on your side of the mattress, and without promoting certain brands or things like that. But I'm happy to give some ideas or products if people are interested. But there are mattress and mattress covers for very low cost. So you don't have to change the whole room, but it can cool your body temperature down. And we know that has a direct impact on sleep. We black out our room. So actually, we've painted our entire room black. And I know a lot of people are like, oh my God, I can't do that. It's actually very beautiful aesthetically, but it also helps with sleep at night as well. And for me, I do that because I don't like wearing a sleep mask. So it's almost like a blackout of the room without having to put something directly over my eyes. We keep technology away. So simply by putting I don't say, like sometimes you need emergency, right? If you have kids, you have to keep things next to you and so forth. But it does, you can still keep it near you, but it doesn't have to be next to you. Right. So the beeps, the lights and all these things that our phone emit, like we don't think they're disturbing us at night, but they actually are. And I can tell you that from evidence because we track this stuff. So every time my phone beeps or a light comes up, or even if it vibrates, it is a wake up moment that I can track on my sleep devices.
Incredible.
And those interrupt. So I can go on and on. There's about 32 different things that we can essentially optimize in your home just for sleep. And we can do it for aging in place. We can do it for proper movement and exercise. We can do it for proper nutrition. We can do it across conditions. So we can go on and on about it. But I hope that was some helpful tips for people who are trying to optimize for sleep.
Very much so. And I think sleep is something we think we can forget. It just happens. And then we realize, no, actually, after a good night's sleep, we're different people. I am. And I show up, even for this podcast, after a good night's sleep in a different way if I hadn't slept well.
Yeah, I mean, sleep. We tend to think of sleep as sort of a byproduct. It's just something that I do, like you said, right? We need to, prioritize it as something that's very important. Like, I'm very non-apologetic. Where if there's something that is not interesting that's keeping me up at night, like, no, I'm like, it has to be something super compelling to keep me up beyond 9 p.m. Let's just say. And listen, there's a lot of circumstances, hanging out with friends or some sort of TV show. I get it, right? Entertainment matters, and having that social atmosphere matters. But if it's not worthwhile, if it's just a matter of binging another show, I will make that, judgment case in my head, say it's not worth the loss of sleep. I'm going to watch that tomorrow during the day or when I'm awake, but I'm going to go to bed, and it's not worth the lack of sleep that it will take away from.
I can relate to that. Well, I could keep you here all day, but I have one last big question for you, Dr. G. I want to ask you about your definition of success. How do you think about it?
Oh my, you're always asking the big questions. Success. So I think, success is different for different people. But for me, I think success is when you have the freedom to do what you want, when you want, with whom you want. So really on your terms. And we can think about it in the context of time. But I think, that encapsulates a lot of things. So you have to be in a good financial state. You have to be in a good health state. You have to be in a good mental state in order to have the freedom to do what you want, when you want, and with whom you want. I think that is, for me, my definition of success.
I love it. I think I feel the same way on many levels, and I like how holistic it is. It's not just one piece, and all of them have to come together to make it all work.
And I think things can be like, that definition can move with time. It doesn't have, again, don't be the sea squirt when it comes to defining what success means, right? There are different factors that will change our perspectives and where we are in life, and with kids or with aging parents or empty nesters, whatever it might be, your definition might be differently. And so what I tend to like to do is I create annual mantras. And these mantras, I mean, they can last a month, it can last a year, it can last 5 years, right? It just depends on what they are. And then I surround myself with little symbols, like I'll create a logo, I'll create a t-shirt or something that reminds me of the mantra. And that becomes sort of my North Star. And that North Star is that North Star guiding me towards what my definition of success is in your circumstance here, or the way I've defined it. And so, for example, my mantra for the past few years was something called Go, Be, Do. And Go, Be, Do stands for go to interesting places, be with interesting people, and do interesting things. And if it didn't meet that criteria, it was a hard no. And so my new mantra for this year was changed. And I had that for probably about 5 years. And I developed that when I was in Africa and I had that injury. And I was like, life is too short to not pursue things that are just interesting, right? So, but now it's changed. And I think it's actually related to some of those small meetings that I talked about before. And my new mantra for this year is, how you do anything is how you do everything. So I've made it a concerted effort to show up, to be present, to not just be the voice or just talk. I want to walk the walk and talk the talk, right? So it's trying to essentially mean what I say that I'm going to do. So how you do anything is how you do everything. And so every little moment you're saying, your phrase, your words, your actions, your feelings, all of those things are reflective of my larger self. And that's kind of how I try to show up every single day.
Sounds like a pursuit of quality. And then I have to tell you, I will not get the image out of my head of that sea squirt and that idea of getting stuck with one way of seeing things and not changing.
See, now you're going to take that story and that ripple effect and you're going to share it with somebody else. And that's exactly what you said. The thrill of speaking is being able to share those new ideas in unique ways that people can own themselves and then tell others.
So. Just the image.
Yeah.
Dr. G, thank you so much for today. This was delightful, and I've learned a lot, and I'm sure the audience will enjoy everything we've talked about today. So I really appreciate it. And
I really enjoyed this conversation. Thank you for the wonderful questions and helping me go down some memory lane. So thank you.
Thank you. You were listening to Talking Billions. We talk about big ideas, big inspirations, big topics. We take on the hardest subject of all, money. But our conversations lead us to an even bigger question: what it means to live a rich life beyond money. If you enjoyed the show, please take a moment and follow, subscribe, rate, and share with friends and family. We rely on word of mouth to promote the show. One click for you means the world to us. Thank you. Until next time, your host, Bogumil Baranowski.